Hey everybody, this is Joe from Choice Physical Therapy. I'm here to talk to you about lower back pain today. Within lower back pain, there's a lot of diagnoses that you might have. A sprain or a strain like a muscle pull. Sciatica is very common. Degenerative disc disease, disc herniations. The lower back pain is really, it's important to start with the anatomy first. So there are 5 vertebrae in our lumbar spine, L1, L2, L3, L4, L5. There's a disc between each of those, and then there's your pelvis and your sacrum, which is a triangular bone that sits right below there. A lot of muscles attach in this area, and like we talked about, there's discs, there's joints. As we age, those spaces get closer and closer together. So any type of lower back pain that we're dealing with, one of the top things that we need people to understand is we want your symptoms to centralize. What that means is the symptoms should start to localize to the lower back. We don't want them to spread out this way. We don't want them to spread into the buttock or down the leg. Typically, if symptoms are moving further away from the midline, that tells us more tissues are being irritated. So even if it's not quote-unquote sciatica, but you're getting a strained lower back muscle with symptoms radiating down, we need you to try to find a position, that can vary individual by individual, but find a position where the symptoms move up. There are 2 key factors that happen. One compensation that happens is called an anterior pelvic tilt, where your pelvis starts to tip forward. As a society, we do a lot of sitting, and our hip flexors get very tight. When that tightens down, it doesn't let your butt muscles do their job, and it tightens and compresses your lower back, creating a lot of irritation. We need to try to find ways to stretch out those hip flexors that let your butt muscles work, keep that pelvis neutral. You'll automatically get a decompression in your lower back, and your abdominals will start to kick in. That's one of the key things we need to focus on. So the 2 big things here are centralization. With your lower back pain symptoms, we want them to centralize and localize towards the center, and we really want to watch some of these postural compensations that happen and we're kind of predisposed to throughout life. Don't let your pelvis tip forward. Squeeze your butt muscles, squeeze your belly muscles, and pull that belt line to level. Those 2 things will make a significant difference with most of those conditions we found. It's always good to consult your healthcare provider or your physical therapist to see which one you might be dealing with individually and how you can individualize that program. That's lower back pain. I'm Joe from Choice Physical Therapy. Have a great day.